reach our maximum, strongest, healthiest bones, sadly, in our early 20s. That's a little depressing, right? But we reach that peak bone density and then our bones stay there for a while. So we're just kind of hanging even there, and that's okay. As we get into our late 40s and early 50s, and particularly with menopause for women, that's when the bone density starts to drop. So, one of the keys to healthy bones is maximizing that bone density early on in our lives when we're probably not even thinking about it. So, calcium, vitamin D, exercising, and then keeping the bone density as stable as we can. And then to watch out when we start that bone loss, because once the bone loss starts, unless you intervene, usually with medications, it's going to keep going down.